Without further notice, the agenda point 9, which is the strategy on harnessing innovation for public health in the WHO region 2025-2030. You should see now the relevant documents for this agenda item on the screen. And as soon as Gundo is ready, I would like to give him the floor. Gundo is the Director of Prevention and Health Promotion Division, who will introduce this item now. Gundo, whenever you're ready, the floor is yours.
I am ready. Thank you. Thank you, Chair, for giving me the floor. And thank you for your stamina to hang in for the next strategy, a very important one on innovation. And I will start sharing a few slides, few only, but I promise. So I will start with something small but powerful. The device that you are seeing here on this slide is a handheld retinal camera, which is able to capture high-quality images of the back of the eye to detect diabetic retinopathy, which is one, as you know, of the leading causes of blindness, and it can detect so even before patients notice any symptoms. So in Finland, devices as this one have led to a 40% reduction of screening costs compared to hospital-based imaging. But here's the catch: most people in our region who could benefit from this device will never see it. What we are facing is what we call the innovation implementation gap, which is a growing divide between what is possible and what is being practiced. Last year, imagine in this region we had 15,700 health patents that were filed, which is one every 30 minutes. So you ministries are actually flooded with pilots and promises, but there is not enough scaling. There are three fault lines between innovation and public health that we see. First, innovations don't always meet the real needs that you health authorities are facing. Second, health authorities struggle often to connect with the right and relevant innovators. And third, scaling up successful pilots into practice is hard, and countries often lack the systems and the skills. That's where we as WHO Euro want to come in and work with you hand in hand to identify solutions that do fit local contexts, to connect public health with innovation ecosystems, and to catalyze scale up by tackling bottlenecks. This strategy wasn't built in isolation. Some of you will remember in March 2024, we hosted the first ever regional meeting on building a health innovation ecosystem and brought together ministries, science parks, innovation hubs, and others to rethink how we can solve public health challenges. When we reported back to you at the regional committee last year, you asked us to develop a strategy, and we did. We did so with the help of a technical advisory group, and we are very lucky to have Professor Plamen Dimitrov next to me with us, who was an active member of this technical advisory group. He's also an executive board member, as you're all aware. And the group that met 3 times in the course of the development, we had 5 stakeholder consultations and received also extensive written input. And every line of this document in front of you reflects this collective effort. Now, what is in the strategy? The strategy for harnessing innovation for public health aligns with GPW 14, EPW 2, obviously, our Digital Health Action Plan, and also the Novel Medicines Platform. Its guiding principles are equity and inclusivity, with a focus on innovations that benefit all populations. Importantly, it's not just a vision, it is a practical guide, and the strategy and its companion document offer step-by-step actions and tools. The strategy focuses on 5 areas to close the innovation gap. And in each area, the strategy mentions actions that member states can consider and what WHO can support. First, innovation only works when policies across sectors, industry, science, tech align with public health. So if you want to develop national health innovation strategies, WHO will offer tailored guidance. Second, innovation needs strong governance and sustainable funding. If you're building innovation bodies or securing long-term financing, WHO can and will share best practice models. Third, innovation requires skills, skilled teams, and modern infrastructure. So if you're investing in capacities and systems, WHO will support with tools, training, and guidance. Fourth, innovation must meet the real needs and deliver sustainable impact. So if you are interested in identifying innovation that indeed is relevant and you want to assess the potential value of such innovations, WHO can help with horizon scanning and assessment approaches. And finally, innovation hinges on breaking silos. Partnerships across ministries, civil society, and the private sector are key. And as you are building these partnerships in countries, WHO will foster regional collaboration and learning. So what's next? Implementation of the strategy starts now, hopefully today, with the approval of the strategy. Next year, we will launch a public health innovation foresight report to map future challenges and opportunities. We are building a digital repository of scaled best practices. In some countries, we will help building national innovation networks, learning from successful models such as the one that we see in Denmark, the Danish Life Science Cluster. And we are planning our first Health Innovation Summit, bringing together ministries, innovators, and civil society to set the agenda, to form partnerships, and to tackle some of the bottlenecks. So let me conclude by thanking all countries and partners and organizations, particularly, of course, the Technical Advisory Group. You truly co-authored the strategy, and even more, what is in front of us is not just a document, but it's a shared commitment to close the innovation gap. So ultimately, our success will not be measured by the pilots and the promises, but how fast and fairly breakthroughs reach every country and every community. And we're looking forward to closing the innovation gap together with you. Thank you.
Thank you very much, Gundo, for this overview. And before we move on to hear from our member states and our non-state actors and other agencies here, I would like to pass the floor to Professor Plamen Dimitrov from Bulgaria, who is also a member of the Technical Advisory Group on Innovation, and he will share with us some further insights on this before we can discuss this point. Professor Plamen, the floor is yours.
Honorable Chair, Regional Director, Honorable Ministers and Delegates. It is a privilege to address the 75th Regional Committee, both in my personal capacity in the lead of public health in Bulgaria and as a member of the WHO Europe Technical Advisory Group on building an innovation ecosystem for public health. This strategy and the accompanying innovation agenda were shaped by the urgent realities facing our region. Demographic pressures, the toll of NCDs, climate change, and health system fragility. Incremental solutions cannot keep pace. We need bold, systematic mega shifts to move from promising innovations to genuine population-level impact. The four mega shifts defined in the innovation agenda are the backbone of this new approach. First, quantum collaboratives. This is about moving beyond fragmented, often profit-driven efforts towards powerful, mission-driven partnerships. In Bulgaria, for example, the good practices of all stakeholders' involvement have enabled national programs for NCDs, strengthened the national health information system, and large NCD prevention campaigns. Second, digital solidarity, meaning democratizing data access while guaranteeing data security, ensuring ethical governance, and building digital inclusion. In that context, I would like to share that Bulgaria is scaling up its national health information system, enabling real-time surveillance, unified electronic records, mobile health for remote and urban populations, improving continuity of healthcare and faster decision-making. Third, accelerated capacity. In that regard, a clear example is the upskilled digital literacy of the Bulgarian medical professionals that contributes for better healthcare delivery. Fourth, prospective financing models that align all stakeholders' interests around value, impact, and sustainability. In that context, I would share that value for money and results-based management are the main principles that Bulgaria follows within the budgetary procedure. In Bulgaria, focusing on these shifts has delivered results. Integrating technology with a more person-centered care for NCDs, progressing to create advanced national health information system, accelerating capacity and aligning health financing with population health outcomes. We need a strong WHO to back us up in the quest for turning the promise of innovation into reality for our population, helping us to ensure innovation meets our real needs, building bridges between all stakeholders in healthcare, and providing support so that effective innovations are sustainably scaled. I want to thank WHO for inviting me and my 14 fellow TAC members to guide and co-author the innovation strategy and its accompanying document. They are the framework we are looking for to ensure innovation serves the people and not vice versa. I trust my colleagues from ministries across the region will agree and adopt the strategy. I look forward to working with the Secretariat to bridge the innovation gap. Thank you.
Thank you very much, Professor Plummen. And thank you for all the insights, Gundo, as well. I would like now to start a discussion on the agenda item 9, and I would like to open the floor to member states. So if you would like to intervene, please raise your name plate, and we will take note, and we will ask you to take the floor. And I see we have a group statement from Denmark, so propose that Denmark takes the floor first. The floor is yours.
Thank you, Chair. I have the honor of speaking on behalf of the European Union and its 27 member states. The EU and its member states support the strategy on harnessing innovation and public health in the WHO European region. This strategy is timely as member states face the lasting impacts of the pandemic, aging populations, chronic diseases, and environmental challenges. It provides a regional framework to coordinate efforts and avoid fragmentation. If we want to ensure that our health systems continue to deliver high-quality care for all, the effective use of innovation is not optional but essential. Yet we recognize that many promising innovations take considerable time before they benefit the patient or show a positive effect on health economics on a system level. Others never reach development or implementation at all or are not scalable. In addition, the benefits of innovation are not evenly distributed. Health inequities remain unacceptably high, and vulnerable groups face barriers to access and innovative health solutions. Too often, innovation pathways are reactive and supply-driven. Regulators, health technology assessment agencies, and public payers have to evaluate what is presented to them by developers. But there is only limited proactive initiative on the types of innovation most needed for public health. This results in gaps such as insufficient progress in areas like NCDs, mental health, climate change impacts, heart and renal failures, rare diseases, and antimicrobial resistance, including the well-documented lack of new antibiotics. We must also look beyond pharmaceuticals and medical technologies. Organizational and cultural innovation, for example in workforce models and task shifting, up to the well-monitored integration of quality-assured self-care practices, can be equally valuable. We underline the importance of a life cycle approach to innovation, prioritizing equity and accessibility, as well as evidence-informed decisions. This requires objective identification of the highest unmet health and medical needs with health equity at the core, fit-for-purpose incentives to steer implementation research and development towards these needs while ensuring affordability and sustainable and equitable access, approval and reimbursement processes that assess new products based on their clinical evidence and real-world performance in addressing priority needs and reducing health inequities, and common approaches to assessing the impact of innovations on public health and equity of access to care, as well as their environmental impact and economic viability. This represents a major shift in how we work. At the same time, we recognize that innovation should not be understood solely as the pursuit of new high-tech solutions. Many pressing public health challenges can be effectively addressed not through novelty, but through the consistent application of established evidence-based measures. Finally, better stakeholder engagement and dedicated resources are needed to ensure that innovation reduces rather than widens health disparities around the region. The principles of evidence-based decision-making, transparency, and appropriate governance of private sector engagement must be at the core of this strategy. Its implementation must be in line with the EPW2 to ensure consistency and maximize impact. This also requires flexibility, cross-sectoral policies, and continuous monitoring with clear targets, as well as maintaining the standards of safety and effectiveness and ensuring robust methodologies. We welcome the idea of promoting a collaborative platforms to accelerate innovation, foster open dialogue, and mutual learning. Chair, the EU and its member states stand ready to work with the WHO and all partners to ensure that innovation truly serves the health of all in the European region. Thank you.
Thank you very much, Denmark. I would propose that we move on with Israel, followed by Estonia.
Honorable Chair, distinguished delegates, Israel welcomes the WHO European Strategy on Harnessing Innovation for Public Health. For Israel, innovation is a cornerstone of our health system. We see innovation not only in technology, but also in governance, data management, and cross-sector collaboration. Israel has developed a nationwide digital health infrastructure linking hospitals, community providers, and research institutions. This system enables AI-driven clinical decision support, predictive analytics, and early detection of disease outbreaks. We've also witnessed how innovation strengthens emergency preparedness and community resilience. During times of crisis, Israel's integration of digital platforms, emergency command systems, and rapid data exchange between points of care has allowed continuity of care even under extreme conditions. These models exemplify how public health innovation can save lives and sustain essential services. We look forward to continuing to advance our Center of Excellence in emergency response for the benefit of the whole region. We strongly support WHO Europe's focus on innovation governance and financing, ensuring that innovation is aligned with public health goals rather than market incentives alone. Israel's regulatory model for testing new digital and AI-based tools aims to uphold this balance, promoting agility while safeguarding privacy and patient safety. Israel is committed to contributing to regional cooperation in digital health. Together, we can ensure that innovation serves all people across the WHO European region. Thank you.
Thank you very much, Israel. I'd like to give the floor to Estonia, followed by Finland.
Honorable Chair, Regional Director, distinguished colleagues. Estonia aligns itself with the statement delivered by the European Union and its member states. We commend the WHO European Regional Office for developing a comprehensive and forward-looking strategy. This strategy will accelerate innovation in health across our region. Estonia has been a long time at the forefront of digital innovation in health. Since 2007, we have established interoperability requirements for all public and private healthcare providers. This enables secure and seamless exchange of data and ensures that patients can access and control their own health information. Clinicians benefit from a complete and holistic overview of each patient's health. 2 decades of health data, combined with 200,000 DNA samples available for research, we have created a strong foundation for developing new medicines, technologies, and services. These resources allow us to link clinical, genetic, and lifestyle information. In turn, this helps us better understand diseases and drive innovation in prevention and treatment. We are also harnessing artificial intelligence to empower healthcare professionals and patients alike. AI tools are already supporting clinical decision-making, identifying drug interactions, and improving triage. Looking ahead, we aim to use data safely and responsibly to predict and prevent disease and offer truly personalized care. Finally, we welcome the strategy's emphasis on collaborative platforms for health innovation. Estonia stands ready to share its experience and expertise. We want all member states to benefit from digital transformation and ensure that innovation serves better health for all. Thank you.
Thank you very much, Estonia. I'd like to give the floor to Finland, followed by Ireland.
Chair, Regional Director, Excellencies. I have the honor to make this statement on behalf of Estonia, Denmark, Finland, Iceland, Latvia, Lithuania, Norway, and Sweden. We welcome and fully support the strategy on harnessing innovation for public health 2025-2030 and stress that equity and accessibility must remain its guiding principles. Innovation should be a driver for strengthening universal health coverage and for reducing health inequities, ensuring that no one is left behind, in particular persons in vulnerable situations. We underscore the importance of responsible, ethical, and trustworthy use of innovation. Effective governance, ethical standards, and evidence-based approaches are essential for building public trust. In particular, the safe, secure, and people-centered application of digital health solutions and artificial intelligence must be prioritized. We highlight the need to strengthen capacity and foster collaboration. Regional and national efforts to adopt and scale innovations will benefit from knowledge sharing, international cooperation, stakeholder involvement, and public-private partnerships, while ensuring alignment with country priorities and the sustainability of health systems. We emphasize the need for an integrated approach where innovation is systematically embedded across health policy, planning, and service delivery. An example of this holistic approach is found in the joint action on preventing non-communicable diseases, where implementation of innovation in public health is central in preventing ill health and reducing social inequities. Coordinated strategies that align technological, digital, and policy innovations with national health priorities will enhance efficiency, sustainability, and resilience of health systems, ensuring that innovation contributes meaningfully to population health outcomes. Thank you.
Thank you very much, Finland. I'd like to pass the floor to Ireland, followed by Montenegro.
Thank you. Honourable Chair, Distinguished Regional Director, Excellencies, dear colleagues. Ireland aligns itself with the statement delivered by Denmark on behalf of the European Union and its 27 member states. Ireland welcomes the strategy on harnessing innovation for public health in the WHO European region. The next 5 years will be a vital period if we are to maximise the opportunities presented to us by modern innovations. We thank the WHO Regional Office for their timely presentation of this strategy. We recognise that the presentation of this strategy, alongside EPW2, reflects the regional office's commitment to dedicate 30% of efforts towards innovation to tackle megatrends affecting public health. We commend the recognition within the strategy of the implementation gap between the breakthrough innovations and their implementation at scale within public health systems, as well as the cost of these implementation delays. We welcome the broad definition of innovation within the strategy and the breadth of innovations acknowledged in the 5 core strategic areas. In Ireland, we are implementing innovative measures to empower our health and care workforce to support the delivery of safe, equitable and efficient healthcare. Advanced Practice is one such initiative for optimising capacity. With 2.7% of the nursing and midwifery workforce now working at that level, and building on this evidence, we are extending advanced practice for health and social care professionals for the first time. For example, we're enabling physiotherapists to refer a patient for diagnostic investigations, such as x-rays. This helps them to work at the top of their expertise, and it results in fewer steps in the care of patients who require diagnostics. Such developments support enhanced performance in our health service and improve the experiences of our patients and workforce. When it comes to tackling NCDs through innovation, Ireland is making real progress by bringing care closer to where people live. For example, many stroke survivors can access early supported discharge services in their own communities. This helps people to recover at home while also reducing inequalities between rural and urban areas. We're also introducing a national advanced software systems to quickly interpret CT scans and other images. This innovation helps clinicians make faster, more accurate decisions, especially when it comes to time-critical treatments such as thrombectomy. For cardiac patients, we're transforming cardiac rehabilitation by leveraging evidence-based, person-centred and technology-supported models. This approach allows patients to receive high-quality support without needing to attend hospital-based services, giving them greater flexibility and independence. We thank the WHO Regional Office for developing this strategy, and we look forward to working with you all during its implementation. Thank you.
Thank you very much, Ireland. I'd like to give the floor to Montenegro, followed by the Netherlands.
Thank you, Chair. Distinguished delegates, dear colleagues. Montenegro welcomes the regional strategy of harnessing innovation for public health and commends WHO Europe for the inclusive consultation that shaped the important policy framework. Innovation is central for Montenegro National Development Agenda. In 2025, we adopted a new law on healthcare that formally recognizes telemedicine, digital health services, and emerging healing technologies as pillars of health system reform. Digital transformation is already reshaping the patient's experience through our e-health portal, e-pharmacy, and e-prescription platforms. Citizens can book appointments, access medical records, and manage their health information electronically. These tools simplify access to care and reduce administrative burden for both patient and providers. A flagship example of our progress in the EU-supported Health Chain project, Health Chain uses blockchain technology to strengthen the security, transparency, and integrity of health data management, an important step to building public trust in digital health system. Montenegro is also piloting smart health station, a new AI-assisted radiology platform connected regional hospitals to national specialists. We believe the regional innovation strategy offers timely opportunity to link national progress with regional learning and co-creating. Montenegro fully supports WHO Europe commitment. Thank you.
Thank you very much, Montenegro. I'd like to pass the floor to the Netherlands, followed by Poland.
Dear Chair, Regional Director, dear colleagues. The Netherlands fully aligns itself with the statement made by Denmark on behalf of the European Union and its member states. We strongly appreciate the consultative process WHO has taken with the member states in these challenging times. Because healthcare in the world is transforming rapidly, and innovation is no longer a luxury, but a necessity. We are very pleased to see that with the innovation strategy, the WHO Euro calls for stronger health system through sustainable innovation, digital transformation, and inclusive collaboration. In the Netherlands, we have a collaborative, mission-driven innovation policy. We are working towards a future where by 2040, everyone lives at least 5 years longer in good health, while health inequalities between socioeconomic groups are reduced by 30%. Very important. Achieving this goal depends on strong collaboration between citizens, researchers, entrepreneurs, and governments. Especially, really listening to each other is really important, especially in these times. A powerful example in the Netherlands is Digizo.nu, where key players in healthcare sectors have joined forces to accelerate the adoption of proven digital hybrid care innovation projects. Supported by targeted government funding in 2024 and 2025, hospitals, care providers, and institutions can scale up and implement these innovations effectively. The result? Better care, less strain on healthcare professionals, and more control for patients. Another example is MedMy Trust Framework. It's operational since 2020. MedMy's core task is to facilitate the digital exchange of health data between residents of the Netherlands and their healthcare providers. By being part of the National Trust Framework, MedMy has been able to show that it's working in a secure, affordable, future-proof and user-friendly way. We expect that this framework will prove to be a valuable pillar in building a reliable health data access service in the Netherlands as required for the European health data space. Innovation only truly matters when people feel its impact. Their impact in their daily lives. So let's work towards that together. We are glad that this ambition is fully shared by the WHO Euro with health and innovation as driver of well-being and resilience and inclusion. So thank you very much.
Thank you very much, the Netherlands. I would like to give the floor to Poland, followed by the Russian Federation.
Thank you. Chair, Regional Director, distinguished delegates. Poland aligns itself with the statement made on behalf of the European Union and its member states. Poland welcomes and strongly supports the strategy on harnessing innovation for public health in the WHO European region 2025-2030. This ambitious and forward-looking framework comes at a crucial moment as Europe faces intertwined health, social, political, and environmental challenges which demand new ways of thinking and acting in the domain of public health. Poland does not view innovation merely as technological progress, but rather as the continuous reimagining of how we deliver equitable, resilient, and sustainable health systems. In the words of Stanisław Lem, the great Polish futurist, you cannot predict the future, but you can invent it. The spirit of proactive creation reflects exactly what the strategy calls for. Building a culture of innovation that anticipates needs, bridges gaps, and transforms ideas into impact. We commend the strategy's focus on integrated innovation policies, ethical governance, and sustainable financing. Strengthening national capacities and fostering cross-sectoral collaboration will allow every country, regardless of size and resources, to benefit from the shared progress of our region in the spirit of equality. Access is key, especially while introducing technological solutions. We must never forget real-life use cases and mitigate constraints, especially for older persons, persons with disabilities, or otherwise socially unprivileged groups. Poland is committed to contributing to the collective effort of harnessing innovation through our active participation in the regional coordination efforts run by the WHO Euro. By sharing best practices in digital health, research, and workforce development, we can truly foster a global public good, which is the health of our citizens. We particularly value the strategy's emphasis on inclusivity and the responsible use of new technologies such as artificial intelligence and precision medicine, while ensuring their sustainability. Ultimately, innovation must serve people first, reducing inequities, improving health outcomes, and strengthening public trust. Together, guided by evidence, ethics, and imagination, we can invent a healthier future for all. Thank you.
Thank you very much, Poland. I'd like to give the floor to the Russian Federation, followed by Spain.
Thank you very much, President, Regional Director, colleagues. We would like to thank the Secretariat for preparing this document. The strategy is a good platform for international cooperation and exchange of best practices. The strategy is significantly aligned with the national interests and documents of the Russian Federation for healthcare. Digitalization and technological development also fall under this. This will allow us to achieve goals that fall under the Russian strategic documents, such as the National Program for Healthcare and Digital Economy, as well as the strategy for science and technological development in the Russian Federation. We can not only be active participants in this strategy, but also contribute to its development, sharing with our own experience in digitalization, normative regulation of innovation, and producing clusters within medicine and medical healthcare. Digitalization of healthcare and biotechnology. It would also be helpful to focus on expert exchanges, on effectiveness, and considering technology and indicators in order to ensure that we have good practices and results. This cooperation can be put into place with the platforms that are already in place, having thematic sessions and participation of member states and the Secretariat. Concerning the use of AI, there is a focus on access for patients, as well as interoperability and transparency of algorithms. Considering the issue of risks in clinical settings and legal documents that are used in this context, we need to ensure that we achieve positive results with their implementation. We also need to consider how data are handled and processed, considering issues of confidentiality and access. As for expert exchanges, we need to have safe exchange and analysis, as well as local storage of data. The results that we expect from these exchanges will help us to increase the implementation of technology in healthcare, and we will continue our professional dialogue with member states and the Secretariat on these various platforms. Thank you very much for your attention.
Thank you very much, Russian Federation. I'd like to give the floor to Spain, followed by Tajikistan.
Chair, Regional Director, distinguished colleagues, thank you for giving me the floor. First, we would like to express our support for the statement delivered by Denmark on behalf of the EU and its 27 countries, emphasizing that innovation must also serve as a driver of social change. Spain welcomes the strategy on harnessing innovation for public health and supports this strategy based on its solid experience in digital health, its biomedical research networks, and its ability to transform knowledge into tangible solutions for citizens. In Spain, the Carlos III Health Institute, together with the 35 accredited health research institutes, constitute a model of strategic alliances between university, hospitals, public centers, and companies, whose central objective is to bring science closer to patients. We recognize that true innovation must go beyond technological and biotechnological advances, and this can only be achieved when equity and citizen participation are prioritized. We need to align health needs with investment in innovation, bring together objectives, and create knowledge and research ecosystems
that can help ensure the sustainability of public health systems, ensuring approval and reimbursement processes based on real evidence and social impact. The creation of the Spanish Public Health Agency and the launch of social participation platforms are key steps towards transparent and collaborative governance. The Ministry of Health of Spain is also working to include social determinants and family context in the digital health record, facilitating a biopsychosocial approach by professional teams and adequately monitoring social determinants of health and health inequalities, another priority for achieving equity. In addition, digital transformation must reduce existing gaps. Spain is working to better coordinate efforts between our autonomous communities, the regions, and strengthen hospital innovation units and ensure sustainable funding. In closing and in summary, Spain shares the vision of inclusive innovation based on evidence and promoting equity and co-governance through dialogue and mutual learning. I thank you.
Thank you very much, Spain. And I think we can only take Tajikistan and then we will make a stop. Tajikistan, the floor is yours.
President, colleagues, Tajikistan welcomes the European Region Strategy, the use of innovation for public health for 2025 to 2030. For Tajikistan, the question of innovation is not only current, but it is absolutely essential. Our healthcare system is going through a stage of quality updates, and we want to ensure that every citizen has access to modern medical treatments. But also, we want to ensure that they come into contact with modern updates. We need to ensure that we are accessing rural areas in Tajikistan, and the question of innovation and new technologies is essential to ensure equal access to medical care. Innovation is telemedicine and remote consultations, digital registers of diseases, and online vaccination lists, remote diagnoses, and other innovations which will allow us to promote health among our populations. The National Healthcare Strategy is a first link, in particular for rural areas, and still lacks some infrastructure and modern equipment. We will need new digital devices in order to carry out positive pilot projects. The strategy of innovation is very relevant in this context and needed. It will allow countries like Tajikistan to put into place positive strategies to strengthen their potential and to develop partnerships with donor and private structures. The implementation of these innovations is fully in line with our aim of transforming our healthcare systems. We should note that, in line with a statement from the President of Tajikistan from 2025 to 2030, have been named the years of the development of the digital economy and development, with the aim of implementing new technologies in the healthcare system. We welcome the support of WHO Euro in the implementation of these processes and developing our potential. Tajikistan is prepared to continue our exchange of experience in order to achieve the best results for our citizens, in particular for those living in mountain and rural areas. Thank you for your attention.
Thank you very much, Tajikistan. And in the interest of time, and because there are some announcements that we would like to make, I would like to suspend the session and come back after our healthy break, after lunch. So we continue with this, and hopefully we can finish up this point before tackling the next one on the agenda. Maybe if we can ask Tajikistan to be the first one after the lunch break. Professor Youssoufi, could you maybe continue with the statement? Oh, really? Sorry. Yes, I had the wrong paper. It would be on Turkey, but they are not there. So I would ask Sashli, Turkmenistan, could you maybe take over? Thank you very much.
Уважаемый председатель, спасибо.
Chair, thank you for giving me the floor. Turkmenistan welcomes the regional strategy on using innovations for public healthcare, and we highly appreciate the WHO European Office's commitment to regional solidarity and inclusive consultations. Guided by the national vision and leadership of the President of Turkmenistan, we are modernizing as a priority our healthcare system by investing in the construction of new hospitals, health centers for mothers and children, and also in state-of-the-art diagnostic technologies. Our approach is based on such programs as the strategy Healthy Mother, Healthy Child, Healthy Future, as well as the National Strategy for the Prevention and Control of NCDs for the years 2021 to 2025, and also the recently launched National Programme for Developing Healthcare Systems for the years 2024 to 2028, which contributes to digital transformation, capacity building, and implementing innovative solutions to improve public health. We would underscore in particular the importance of the One Health approach, which unites the health of humans, animals, and the environment. This year, Turkmenistan held the third national intersectoral meeting on One Health to strengthen preparedness for pandemics and to develop intersectoral cooperation. We also closely collaborate with WHO and our partners on issues of digital training for young people, including the initiative Immune Patrol. Turkmenistan supports the new regional strategy and review it as a timely and practical instrument to promote innovation, and we express our readiness to cooperate with WHO and member states in order to transform innovations into sustainable public healthcare achievements across the entire region. Thank you.
Thank you very much, Turkmenistan, and thank you for taking over so quickly. I would like to give the floor to Ukraine, followed by Uzbekistan.
Dear Chair, distinguished delegates, colleagues, Ukraine strongly supports the adoption of WHO European Strategy for Hastening Innovation in Public Health. The strategy names a fundamental problem with honesty. Innovation exists, but health systems are too slow in adapting it. That delay costs lives. It leads to avoidable disability, preventable hospitalization, and loss of quality of life. For us, this is not theoretical language, it is daily reality. Ukraine operates under the conditions of full-scale invasion. We are treating severe trauma, providing advanced prosthetics, delivering rehabilitation, supporting mental health, rebuilding hospitals after direct attacks, and keeping primary care functioning. In such conditions, innovation is not a luxury. It's how the system stays alive. When we speak about innovation, we are not speaking only about artificial intelligence. We are speaking about interventions that really exist and already save lives in high-income countries, but are still out of reach elsewhere. The HPV vaccine is preventing cervical cancer. The RSV vaccine protection of newborns through maternal vaccination. Next-generation pneumococcal conjugative vaccine protects children from little pneumonia and sepsis. They are part of routine immunization in some health systems, but remain financially inaccessible or not included in national programs in many lower and middle-income countries. The same inequality exists for medicines. We already have curative antiviral treatment for hepatitis C. We have modern short-course regimes for drug-resistant tuberculosis. We have medicines that reduce deaths from heart failure and keep patients alive and out of hospital. These therapies are standard for care in high-income health systems, but in countries that carry the highest burden on the disease, they are still unaffordable, unavailable, and not reimbursed, blocked by price and patient barriers. It is not a scientific gap, it's a political and financial gap. In this current standard for some countries and an accessible privilege for others. Our shared responsibility as a region is not only to develop the next generation of high-cost technologies, but to make proven save-life measures available to everyone, regardless of patient status, income, or geopolitics. We fully share WHO European vision of integrating innovation into health policy, service delivery, and financing. We welcome the strategy's focus on governance, national capacity, and sustainable funding models. These elements are essential for rebuilding and modernizing a health system under attack, and for ensuring continuity of care during recovery. Ukraine stands ready to work with WHO and all member states to implement this strategy and to contribute our direct experience in using innovation to keep essential health services functioning under the extreme pressure. Thank you.
Thank you very much, Ukraine. I would like to pass the floor to Uzbekistan, followed by Turkey.
Уважаемый господин президент.
Chair, colleagues, ladies and gentlemen, first of all, thank you for the opportunity to address such an important issue, the use of innovation for public health in the European region of the WHO. Uzbekistan sees innovation as a key instrument for modernizing the healthcare system and improving the quality of medical services. In the framework of our national programs, and the strategy for 2030, we're paying particular attention to digitalization, introduction of new technologies, and improving potentials. The government actively supports innovation through the activities of the Agency for Pharmaceuticals from the industrial sector, starting the electronic platform for healthcare provision, introducing telemedicine and an electronic medical card. We're stimulating foreign and private investment. Measures such as digitalization of the provision of doctors' services from distance and monitoring from distance, helping patients. Providing medicine and in remote regions is the subject of a number of projects, particularly in a couple of regions which are particularly remote and have difficulty accessing specialist services. The government is working to provide medicines to remote regions with the support of these services that provide remote services, and we are also integrating AI and personalized medicines into the delivery of services. We welcome the strategy. We recognize its significant potential to strengthen regional cooperation and achieving the sustainable development goals in the area of health. Uzbekistan is ready to work actively at the regional and global level to promote healthcare innovation. We are convinced that the exchange of best practice and projects will mean that we can more quickly reach these SDGs and ensure well-being for all. At the beginning of the statement, we were shown the project that is taking place in Uzbekistan with the support of the WHO, where we have developed a map for patients with diabetes, and we're continuing to broaden and scale up this program, and we'll report on results to the regional office. Thank you very much indeed.
Thank you very much, Uzbekistan. I'd like to pass the floor to Turkey, followed by Belarus.
Thank you, Chair. Distinguished delegates, we thank WHO Secretariat for developing this comprehensive and forward-looking strategy and extend our appreciation to all member states for their constructive engagement during its preparation. We recognize the integrated innovation policy for public health as a strategic priority of critical importance. It provides a coherent framework to foster innovation across systems, strengthen health resilience, and accelerate equitable access to innovative solutions in our region. This strategy is essential for advancing universal health coverage and achieving sustainable development goals both within the European region and globally. We value the clear sections on actions for member states and WHO Europe, which provide clear direction for translating ambition into measurable outcomes. Its fully and timely implementation will be key to the strategy's success over the next 5 years. Finally, we thank the Secretariat for including a strong monitoring and evaluation component, which will ensure accountability, transparency, and learning throughout implementation. We look forward to continued collaboration in making this strategy a driver of sustainable public health innovation. Turkey supports the draft decision in this agenda item. Thank you.
Thank you very much, Turkey. And I would like to pass the floor to Belarus.
Уважаемый господин председатель, уважаемые коллеги.
Chair, colleagues, the Republic of Belarus is confidently moving forward to providing modern and sustainable provision of services in healthcare. And a key role in this is played by innovation with particular focus on digitalization. It's important to note that the broadening of digital healthcare is something provided for in the strategy for innovation in the area of healthcare and the strategy for use of innovation for public healthcare in the European region from 2025 to 2030. This work in Belarus is based on the creation of a central information system for healthcare, which gathers, exchanges, and provides important healthcare integration. This information system has an integrated healthcare card, which is available for patients and their local healthcare office. And it's something which is integrated into the whole system. We're working with the WHO to prepare a seminar for specialists for training of IT. And one promising area is the introduction of artificial intelligence, which can improve the quality and the effectiveness of medical services as provided for in the National Healthcare Strategy. AI is something which is seen as an auxiliary instrument. Diagnostic decisions will remain with doctors. Working with the WHO country office, we're using IT resources, the electronic patient atlas, which serves as an effective instrument for supporting doctors in primary healthcare in consulting patients. And at the same time, as we introduce digital technologies, we are seeing the development and improvement of traditional methods of medicine. And this is a balanced approach. It helps not only to strengthen our international ratings, but also moves us towards the achievement of SDGs. Belarus has become the first country in Central Europe and Eastern Europe and Central Asia to effectively address the response to tuberculosis with timely diagnosis and effective administration of medicines. With the support of the UNDP in 2022 and the support of NGOs, we have developed a clinical protocol for the treatment of tuberculosis amongst adults and children based on the recommendations of the WHO and on the basis of a broad protocol for treatment. We've worked with other states of the Commonwealth of Independent States, and out of this work it's important to note that we are continuing to cooperate with the WHO Centres for the Development of New Medicines and the introduction of new ways of treating tuberculosis where it arises. We have therefore developed unique experience in combating tuberculosis. Throughout Belarus now, doctors can follow an improved treatment and protocol on the basis of the knowledge acquired. Now we're continuing to exchange experience. We're willing to do so in the future, and we look forward to innovation and technological development in the healthcare sector. Thank you.
Thank you very much, Belarus. I don't see any other member states who would like to take the floor, so I would move over to the UN agencies and other international organizations. As you know, like we did it before, we are piloting by a pre-established speakers list of the partners and NSAs here as well. And I would like to start with the first one on the list, which is the United Nations Population Fund. Can I ask you to take the floor, please?
Your Excellencies, dear colleagues, dear partners, UNFPA welcomes the Regional Strategy on Harnessing Innovation for Public Health 2025-2030, which sets out a forward-looking vision to embed innovation across all levels of health systems, aiming to close the gap between emerging solutions and their practical adoption. The areas of the strategy respond to the priorities of the region, where health systems continue face challenges from demographic shifts, workforce and budget shortages, emergencies, and the impact of climate change on health. The strategy's emphasis on digital health and data ecosystems aligns closely with ongoing UNFPA-WHO collaboration, especially in promoting equitable access to digital SRH information and services, strengthening data use for decision-making, and supporting country digital health strategies. WHO's focus on innovation efforts, a clear entry point for joint UNFPA-WHO advocacy and technical support to help governments identify sustainable models that integrate health innovation into national budgets and investment frameworks. Innovation in digital health are key priorities for UNFPA's regional and country programs. Moreover, our programs serve as a Futures Lab for UNFPA globally. We are actively scaling digital solutions and mobile applications to deliver SRH and gender-based violence information to population and service providers. One of the success stories is our cooperation with private sector with digital applications Flow, AMA, and Balance, which enabled us to reach over 70 million active monthly users, women of reproductive age and menopausal women. At the country level, we work with WHO and national counterparts and advanced telemedicine with particular focus on maternal health, women with disabilities, men, and other groups. We are committed to using digital advancements to future modernize the trainings for health providers and social workforce, ensuring that they are equipped with complex and ready to address the complex health challenges in future. We stand ready to work with WHO and member states supporting the implementation of the strategy. Thank you.
Thank you very much for your intervention. I would like to pass the floor to Southeastern Europe Health Network Secretariat, please.
Thank you, Chair. Excellencies, distinguished delegates, on behalf of the Southeastern Europe Health Network Secretariat, I wish to express strong support for the strategy of harnessing innovation for public health. We commend WHO Europe under the leadership of Dr. Kluge and the entire team for developing this forward-looking and action-oriented framework. In today's world, innovation is the price of staying relevant. For Southeastern Europe region, the integration of innovative approaches is particularly vital to bridge resource gaps, address workforce shortages, NCDs, mental health, and especially to ensure more effective policies in public health. The CHN has already embarked on this journey, advancing digital transformation and amplifying human potential under the Israeli presidency. We recognize with appreciation the strategy's 5 pillars and especially the accent on collaborative platforms. These pillars resonate deeply with our regional priorities and ongoing work to create common health innovation space across the Southeastern Europe. In particular, we call to foster country capacities and equity-driven innovation aligned with CHN commitment to make innovation work for everyone and everywhere. We encourage WHO to continue engaging with intergovernmental organizations such as CHN and implementing partners to translate this ambitious strategy into tangible results on the ground. Southeastern Health Network remains committed to contributing with expertise, sharing good practices, and supporting the collective goal of a healthier, more innovative, and more resilient European region. Thank you, Chair.
Thank you very much for your intervention. With this, I would like to move over to the statements by NSAs. And here again, we are running down a pre-established list. And I would like to start with the European Forum of National Nursing and Midwifery Association, please.
Thank you, Chair. The European Forum of National Nursing Midwifery Associations, together with the International Council of Nurses and the European Nursing Students Association, strongly support the resolution to adopt the innovation agenda for public health in the WHO European region 2025-2030 and its transformative mega shifts. We commit to partnering with the WHO Regional Office for Europe and member states to ensure that nursing and midwifery professionals are active co-creators rather than passive recipients of innovation in the public health agenda and digital transformation. We believe implementing the innovation agenda will strengthen health systems facing converging crises like geopolitical instability, demographic shifts, and post-pandemic fragility. Furthermore, the projected shortage of over 4 million healthcare and social care workers in the region by 2030 necessitates innovation in recruitment and retention strategies. So, innovation is needed not only in technology, but also in the structures and processes of healthcare delivery and management. To have a powerful impact on public health, government regulation is required to support career progression for nurses and midwives, from generalists through to specialist and advanced practice roles. The roles of nurses and midwives are expanding, but there is variation across the region. It is time to recognize the education and competence of nurses and midwives, granting advanced practice nurses and nurse practitioners the right to prescribe, and thereby improving access to the care in all countries in the European region. We urge member states to enhance the role and influence of chief nursing and midwifery officers at the national level, or to establish such roles where they are not in place yet. As the frontline healthcare providers closest to patients and communities, nurses and midwives must be included in digital and AI governance structures, including in leadership positions. It is also vital to involve patients and families. This approach will ensure that technological solutions preserve human-centered care, reduce administrative burdens, and improve equitable access to quality healthcare services for all. Thank you.
Thank you very much. I would like to pass the floor to the International Federation of Medical Students Associations, followed then by the European ME Alliance.
Honorable Chair, Regional Director, distinguished delegates, I, Ivan Badarski, speak on behalf of the International Federation of Medical Students Association, representing 1.5 million medical students from more than 120 countries, including 48 within the WHO European region. IFMSA commends WHO for positioning innovation as a cornerstone of resilience and equitable health system. As future health professionals, we see innovation not only as technology, but as a commitment to equity, sustainability, and people-centered care. While artificial intelligence and digital health hold vast potential, their use must be guided by ethics, transparency, and public trust. Innovation that ignores social, environmental, and human rights risk widening inequities rather than closing them. For instance, only 19 countries in the WHO European region have developed guidance evaluate digital health innovations, vital for safety and quality. Those technologies must enhance accessible and high-quality care, but they should never substitute for human-centered approaches. It is therefore crucial to capacitate healthcare professionals, students, and trainees for effective and just implementation. Technology such as artificial intelligence requires a human-centered approach that engages communities, marginalized population, and young people, that puts their well-being first. This demands proactive planning and dedicated financing, such as horizon scanning. Thus, we urge the member states to invest in innovation capacity and research infrastructure, though sustainability funding models to effectively implement sustainability and innovative solutions that respond to needs of all members of society, train health professionals in digital and AI literacy so that they can use those tools responsibly and effectively, and contribute to the new innovations that benefit communities, strengthen governmental and ethical frameworks for health innovation, ensuring data privacy and safety, integrate sustainability into innovations, recognizing that the carbon footprint of AI and digital systems must be undermining the climate and health goals, establish platforms that fund streams to support student-led and young-driven health innovation that initiated formally recognizing young people as essential co-creators in the health innovation ecosystem. Innovation should not only solve today's problems, but also build systems that anticipate future challenges. Together, we can ensure that innovation in public health is ethical, inclusive, and sustainable, driving progress that truly leaves no one behind. Thank you.
Thank you very much for your intervention. I'd like to pass the floor to the European ME Alliance, followed by the International Diabetes Federation Europe.
Honorable Chair, esteemed delegates, myalgic encephalomyelitis, known as ME and sometimes referred to as ME/CFS, devastates lives. Many patients spend years in darkened rooms, too weak to sit up, completely dependent on others for survival. They are invisible, unseen, unheard, living in silence because social and health systems are not equipped to help them. And the United Nations Convention on the Rights of Persons with Disabilities is not implemented in a way that legally protects them. This leaves millions of lives diminished, families broken and impoverished, and an epidemic of preventable suffering. The WHO strategy on innovation in public health offers a turning point. Myalgic encephalomyelitis is exactly where innovation is most needed. Digital health and telemedicine can reach those who cannot leave their beds. Home-based care and personal assistance can prevent overexertion and the worsening of disability levels. We call for investment in a coordinated, collaborative European strategy of biomedical research to produce an infrastructure with the capacity to understand the disease, support patients, and develop effective treatments. To include ME is to turn neglect into leadership. It is not only sound policy, it is a moral and scientific imperative. It embodies the values of this strategy: equity, inclusion, and the right to health for all. The European ME Alliance will be pleased to work with WHO Europe member states in establishing collaborative centers of excellence for ME throughout Europe. Thank you.
Thank you very much. I would like to ask give the floor to the International Diabetes Federation, followed by the Médecins Sans Frontières.
Thank you. Chair, distinguished delegates, the International Diabetes Federation Europe, representing the voice of people living with diabetes across the WHO European region, supports the strategy on harnessing innovation for public health. For people living with diabetes and other non-communicable diseases, many unmet needs persist across diabetes prevention, management, with the ultimate unmet being that of a cure. Innovations in all its forms, including technological, clinical, and organizational, have already shown their potential in transforming lives and improving health outcomes, as seen with advances such as continuous glucose monitors, automated insulin delivery systems, and integrated models of care. However, the benefits of such innovations are not reaching everyone equally. Ensuring equitable access and uptake across all populations in the region will be the essential if this strategy is to deliver on its promise and avoid widening existing health gaps. Equally, innovation must be co-created with those it seeks to serve. The meaningful engagement of people with lived experience, including youth voices, in the development, implementation, and evaluation of all innovations is vital to ensure that solutions are relevant, acceptable, and equitable. By combining a coordinating vision of WHO Europe on addressing non-communicable diseases, innovation with equitable access, and meaningful involvement of people with lived experience, this strategy can help us move closer to achieving better health for all, leaving no person with diabetes or at risk behind. Thank you.
Thank you very much for this. I'd like to give the floor to Médecins Sans Frontières, followed by the European Nursing Students Association.
Distinguished delegates, colleagues, Doctors Without Borders, MSF, welcomes the strategy's guiding principles of equity and inclusivity, as well as ensuring that innovations benefit all populations, especially the most vulnerable and underserved. We would, however, like to draw the committee's attention to several critical areas that need to be addressed to ensure that this aim will be fulfilled. Firstly, affordability. Ensuring affordability is essential to harnessing the full potential of health innovations. As MSF, we have witnessed how unaffordability of new tuberculosis medicines within the European regions prevent patients from having access to the optimal treatment regimens. The strategy makes only a brief reference to this major access barrier, which in our experience often is caused by market failures and not only deficiencies in health policies. Secondly, transparency. WHO member states, with the support of WHO Europe, should promote transparency regarding research and development, manufacturing costs, public funding contributions, and pricing. We call for further focus on transparency in line with the aim of the ongoing work of the Novel Medicines Platform. Access conditions related to public funding. Public funding should be tied to clear, enforceable access provisions, including affordable pricing, reliable supply, and the sharing of data, knowledge, and technology, preferably on a non-exclusive basis. As MSF, we also recommend that public funding goes to non-for-profit R&D initiatives, such as the Drugs for Neglected Disease Initiative or the Global Antibiotic Research and Development Partnership. Lastly, technology transfer. On the issue of technology transfer, countries should not limit their policies to support voluntary agreements, but also consider compulsory measures when innovations are unavailable or unaffordable. This is particularly relevant during health emergencies, when countries must use the flexibilities under the WTO TRIPS agreement to promote scientific collaboration. MSF stands ready to support WHO Europe and its member states in developing and implementing strategies to foster the most needed health innovations and ensure equitable access to them. Thank you.
Thank you very much. And I'd like to give the floor to our last intervention, the European Nursing Students Association. You have the floor.
Dear Regional Director, dear state, dear non-state actors, on behalf of the European Nursing Student Association, the only association representing the nursing students in the WHO European region, we would like to highlight the importance of the simulation in healthcare. Simulation can play a crucial role in public health prevention campaign by raising awareness and preparing communities to respond effectively to health challenges. For example, it can help the public better understand what daily life is like with the chronic conditions in older adults. By allowing people to experience this limitation firsthand, promotes the understanding of aging, enhances understanding of public health issues, and strengthens community resilience. At the same time, it's important not to overlook innovation in healthcare education, which is essential to improving patient care and preparing future professionals to meet the demands of clinical practice. Innovation in healthcare must go hand in hand with the innovation in education, because the quality of care delivered tomorrow depends on the quality of education provided today. In education, simulation services as a bridge between theory and practice. Through mannequins, virtual reality, or standardized patient, it allows students to develop communication, teamwork, and clinical decision-making skills in a safe and reflective environment, guided by the ethical principle, never the first time on a patient. To conclude, the European nursing student call for stronger support to integrate simulation into educational programs and public health initiatives, as well as to strengthen and sustain existing simulation programs to maximize their impact.
Thank you very much for this intervention. And this concludes the interventions. I would be happy to give the floor now to Dr. Gundo Weiler to respond to any questions and comments.
Thank you, Chair. And thank you, first of all, to everybody, despite the late hour, for so many interventions, to our member states and our state actors as well, affirming the immense potential of innovation to transform our health systems. But your contributions also highlighted that moving from the promise of innovation to tangible and in particular equitable impact remains a significant challenge. And I would just like to try to pick up on three themes that I heard from your statements. First, the sheer abundance of innovation is very encouraging, from technological advances in artificial intelligence and digital health, but also to many non-tech, non-pharmaceutical innovations, as many of you pointed out, for instance, in with regard to governance, social approaches, as we've heard from Israel and Ireland, for instance. You've shared compelling examples of innovation that are already embedded in your health systems, such as Estonia and Bulgaria in the digital space. We heard from Turkmenistan and Belarus on diagnostics, Ukraine in rehabilitation, Uzbekistan in telemedicine, and many others. But harnessing this wealth of innovation requires effective policies and in particular inclusive partnerships. As we heard from the Netherlands on the quadruple helix model or the Carlos Institute in Spain, particularly with regard to meaningful participation of those that innovation seeks to serve, and non-state actors and health workers. So to support this, we are envisaging the creation of a digital repository that can house case studies about such good practices. Second theme, scaling innovation also often does not happen or is delayed, which is not a trivial matter, as you've pointed out, but actually can cost lives. And that also applies to some of the innovation that is actually already well established in some countries, but not, for various reasons, introduced in others. So in particular, we note the strong call for ensuring that innovation scale-up benefits all populations, including rural populations, as pointed out by Tajikistan and Uzbekistan, so that it reduces inequities and not increases them. Encouragingly, several countries such as Montenegro, Turkey, the Russian Federation have already developed strong innovation governance frameworks and are exploring also innovative financing mechanisms. So by learning from these examples, we can certainly accelerate impact. And the third and final theme is that despite all the flourishing innovations and innovation ecosystems, we do have gaps that endure, and particularly that refers to addressing health inequities in some neglected areas. So we're particularly grateful for the candid reminders also from our non-state actors about the inequities and critical blind spots such as NCDs, including diabetes, mental health, chronic fatigue syndrome, and others. This reinforces the necessity for robust agenda setting and needs assessments to ensure that innovations target the most pressing public health challenges. So to close, we recognize that WHO is a small player within the vast landscape of global public health innovation, but our unique strength lies in agility and in our convening power, as you've pointed out very well as well in the EPW2 discussion. So guided by this strategy, WHO will act as an impartial convener, bringing together health authorities, innovators, and partners to spotlight impactful innovations and to facilitate matchmaking and tackle the barriers that prevent us from scaling those up. So maybe I can just close by calling out a nice quote from Poland, where you said, you cannot predict the future, but you can invent it. Thank you very much. In this spirit, our innovation team, and I also want to thank our innovation lead, Mo Chibi, who's sitting behind me. We all look forward to working with you collaborative to transform innovation potential into lasting public health gains for all people across the region. Thank you. And back over to you, Chair.
Thank you. Thank you very much, Gundo. And I'd like swiftly pass the floor to Hans for some comments, and then we'll take it from there.
Thank you, Chair, and Gundo and Mo and the whole team, and Professor Plammen for a very strong support as a member state. I think, Gundo, that you replied very, very well. The point to stress indeed is for WHO to create a safe space, to bring the different parties together. I was very impressed when we had the first meeting. That was when Dr. Gordon Galea was still the director responsible for innovation. We have so many innovation hubs in this region with enormous budgets, but they lack the knowledge of what I call the public health pain points in our member states. But they really are ready to help. So just this convening to bring them together, I think will be very, very helpful, particularly to identify a framework how to scale up those innovations, including the affordability. And the second point is to thank very much our colleagues from Hungary who have kindly stepped forward, right, to host an innovation summit next year, which we're very, very much looking forward to. Thank you.
Thank you very much, Hans. That concludes this agenda item, and we are now ready to consider the proposed draft decision contained in document EUR/RC75/conf/2 on a strategy on harnessing innovation for public health in the WHO European region 2025-2030 and its related costing. Is the committee willing to adopt the proposed draft decision by consensus? I see no objections. The decision is therefore adopted. Thank you very much.